Hello, everyone. Welcome to Everything. Our episode today has not come at a better time during this pandemic. We watch the news, we go on social media, we listen to a lot of stories, and honestly, things can be so overwhelming. We can all be more confused, we can be anxious, and there's just a lot of things going on. And like me, and probably like most of you, whenever we feel a little low, we're worried about our health, it's always good to listen to a doctor. And we're very lucky to have with us one of the most respected doctors in the country, an internal medicine and infectious diseases specialist, all the way from Ontario. Welcome to the show, Dr. Abdu Sharkawy. Hi, Dr. Sharkawy. Welcome to Everything. We're so happy to have you. How are you?
I'm great. Sun is shining and cases of COVID-19 are low all across Canada. So what more can we ask for? I'm very happy.
Exactly. We're all looking forward to, next year when things will be better. And of course, with your help, how can it go wrong, right? We just need everyone to really listen to doctors' advice. And we've been following you since the pandemic began. I've been on TV and watching you, and I couldn't believe that we are finally going to be able to share your valuable input. So thank you. And it's been like 5 months since we got into this pandemic. And I know that you've been right there from the start. And, we're very happy to see a lot of people, a lot of stories of recovery. And when suddenly we're seeing people who would come back with symptoms of like they're coming back or lingering symptoms. And I just wonder why this is happening after, you see people cheering that they're finally out and then something happens. Is there anything that we're missing, doctor, or what is your insight about this one?
Yeah, first of all, thank you very much for having me. It's a pleasure to be able to connect with Canadians from coast to coast through different media outlets and whatever means we can to share knowledge, information with one another and help support each other through this. It's always a welcomed opportunity. So thank you for having me. One of the things that I learned, early on in this pandemic is just how humbling an experience this can be, not only as a physician, but as a scientist and, someone who thought they had a pretty good handle on what viruses do, how they behave, how we react to them, biologically and otherwise. And I think we've learned a lot about COVID-19 in terms of it being very unusual, very unique, not only in terms of how it spreads and who is susceptible to it, but how our immune system reacts to it. And there's still a lot that we don't know about that. What we can say is that the combination of causing organ damage in multiple parts of the body is something that is somewhat unique to this virus compared to a lot of other respiratory viruses. It tends to do it more frequently. It tends to do it much more secretively, if you will, unexpectedly. And the immune system does not always react to it in a very predictable way. And anyone who has autoimmune disease understands the fact that when the immune system reacts too exuberantly to something, anything, it can lead to more problems than anything else, and it can cause damage within our bodies. And I think it's a combination of both of those things, unfortunately, that's leading to these problems. We see young people who have had COVID-19 who have chronic headaches, for example, or they have chronic joint pain that has never really gone away since the initial infection itself. And these are things that I think should make us very leery going forward. And I think should really reinforce for us just how absolutely important it is to try and prevent exposure to this virus in the first place. It's not enough to try and convince ourselves that the fatality rate, is low compared to the first episode of SARS in 2003. It's not enough to suggest that people that are over the age of 60 or 70 are the ones most likely to die, because the problem is it's very unpredictable in terms of who and why, depending on their genetic makeup, depending on the particular circumstance they're in, might end up with a very bad outcome from this virus and may have symptoms that you mentioned are lingering and may not go away very easily. And that's a tragic situation that we need to avoid.
I know it's really sad. Like we've seen people who had to have lung transplants, or I've heard about stories of people who would have nightmares, and so it's affecting mental health.
Well, there's no question about it. I mean, that's a sort of parallel pandemic that we're seeing right now is number one, the distress that is caused by the uncertainty around the virus, whether someone will become infected or not, what sort of risk they're putting themselves at, depending on their work situation, their family environment, their social environment. But on top of that, the isolation that's caused by the lockdown measures that were imposed, the loss of jobs, the loss of social bonds that have unfortunately resulted from the response to this pandemic. This has created a mental health crisis, unfortunately, that also needs to be prioritized. We can't lose sight of the fact that there has been an immense amount of collateral damage that has occurred throughout this pandemic. We need to be very compassionate towards one another and supportive of any resources that we can enlist for ourselves and for each other to make sure that we address issues around depression, anxiety, social isolation. I have seen it affect all segments of our community, particularly young people. And I think that that's an important area of focus that we need to pay more attention to now. There's a lot of stigma that's attached to young people and a suggestion that they maybe don't care as much about things, that they are not being responsible about their behavior. And I think we have to be very careful to resist the temptation to paint whole segments of our community with the same brush. We have to recognize that every segment of the population has gone through its own sort of trauma and difficulty in coping with this pandemic, and we need to give them the tools and engage them with constructive messaging rather than assigning judgment and blame. I think that's a big problem that we need to fix right now.
And you're very right. Mental health will affect anyone, and again, it depends on where you are prior to the pandemic. And if you're already feeling low and anxious or depressed, and this happens, and your only tool is to really find physically a shoulder to lean on, and then suddenly you can't even find that shoulder. I remember my friends would say, back in the day, you would sneeze and people go, bless you. Now you sneeze and like, whoa. So all of this stigma and the attitude, the behavior of people has definitely changed. So I thought I would want to ask you, how will we know, like, once I was coughing because I was talking to someone and he was pretty close at work, and that caused me anxiety overnight because I would cough and I asked my husband, oh my gosh, I wonder if I have COVID. So how will we know if this is now COVID? Like, how long should we observe ourselves when we're starting to cough that we might be in danger?
This is certainly a challenge. I mean, one of the big issues around COVID-19 is the symptoms can be very, very nonspecific. They can be very subtle. They're not always obvious in terms of a fever, a cough, shortness of breath, chest pain. The symptoms that we typically would look for when we think of a bad respiratory illness, may not be the case. I've had patients that I've admitted to hospital who've had something that looks like the stomach flu, food poisoning, and it's all been COVID-19. I think the key is one, to have a heightened sense of suspicion, regardless of what your symptoms might be, but to balance that against good health hygiene practices. And if we are not putting ourselves in situations that are risky, I think we can feel relatively confident and secure that we're not always going to be at risk for COVID-19 if we have something that is a little bit out of the ordinary. And I'll point to what I refer to as the 4 Cs. These are the situations in which COVID-19 is more likely to be transmitted from one person to the next. And if we pay attention to these, we'll be in a better position to determine if we are doing something that may be relatively unsafe, and we may want to avoid those situations. So the first C is closeness, which, as you mentioned, is simply being physically close to another person, and that's why we try and avoid being within 6 feet of other people, when possible. The other is closed situations, which means that you're in a closed environment indoors where ventilation may not be optimal and airflow may allow the virus to more easily spread from one person to the next instead of going out through a window or into the atmosphere around you. The third one is crowds, and that's sort of intuitive, that the density of people around you is going to dictate the likelihood that if an infection is present in one of the members of a crowd, it's more likely to spread if the crowd is bigger. And then finally, the one that I think a lot of people don't necessarily pay as much attention to as they should is continuous exposure. And so if you have a very fleeting exposure, meaning that you picked something up from the floor, somebody dropped their wallet, someone didn't happen to be wearing a mask, and one person coughed, that might induce some anxiety, but it's actually probably a lot less worrisome than having a conversation with somebody for 10 to 15 minutes when you're in close proximity to one another. So the time that you are spending around somebody else, particularly in any sort of proximity and with an intimate environment being created, leads to a lot more trouble than otherwise is the case. So I really would want people to think about those 4 Cs whenever they're determining if they should be doing something, who they should be doing it with, if it's safe or not. Closeness, closed spaces, crowds, and continuous exposure. A combination of those things where one is worse than the other will increase the risk. And if you can check those off and say none of those are happening, chances are you're probably going to be pretty healthy most of the time.
Thank you, doctor. Yeah, I can tell it's a matter of having that checklist imprinted in your mind, right? And the fact that you put them all under all C's, and I know you have another slogan for the 3 W's, and it's pretty easy for us to remember, especially for people like me who tend to forget a lot of things. But that is really good to have everything under a sort of a checklist, and it helps us stay focused. And because it's not easy to stay focused, you tend to be still the natural person that you are. You start talking and then you realize, oops, I'm getting too close. And just before I move on to my next question, I'm just going to let the audience know that we did learn a lot from your slogan of 3 W's. So that's watch your distance, wash your hands, and what was the other W?
Wear a mask.
Wear a mask, which is actually another reason why I wanted so much to talk to you. I saw one of your videos before where you showed how people should be wearing their masks to avoid your glass, causing fog when you're wearing glasses and that wire and things like that. And that was really very useful. And I was wondering if you had anything to add to that or to tell everyone, because a lot of people still do not believe in wearing masks.
This is obviously a very controversial issue, and it baffles me to understand why it has been made a political issue. There's pretty solid evidence that mask wearing is something that very impressively reduces the transmission of this virus. We have very good evidence from other regions that have adopted this strategy that it really helps reduce the incidence of new cases. And we've seen a very good temporal correlation with the introduction of universal masking policies in places like Germany, for example, and Italy, it's very difficult to suggest that it's just a coincidence that within 3 weeks of introducing universal masking, you see a radical decline in the incidence of new cases. So, we could sit here and debate the evidence till we're blue in the face, but it sort of defies common sense to suggest that it's not going to help. That's the first thing. The other issue is, can a mask actually cause harm? And I think we have pretty solidly refuted that as well. There's absolutely no basis to suggest that it will actually cause more difficulty with oxygenation, that it will increase the risk of infections to your skin, around your mouth or nose. All of these have been really quite effectively debunked, both by myself and others. But I want to touch on the issue of difficulty in wearing a mask and the anxiety that it might induce in some people, because I think that this is something that's not really, discussed in maybe the most open-minded sense. And, I see people all the time who are in public, and they may be employees in a store, for example, and they're not wearing their mask properly. I think it's very easy for the temptation to draw us into judging that person and deciding that they don't care, for example, or that they're being irresponsible. And sometimes people feel a great deal of anxiety around wearing the mask. They feel somewhat claustrophobic. And it's important to try and help people like that minimize the degree of anxiety that they may have by wearing a mask, and by giving them the tools that will help them feel more comfortable and confident wearing it. I've talked about this before. I have posted on different, mental imagery techniques that people can use before putting on their mask, that breathing exercises will help. And if they feel like they're having difficulty with breathing after a period of time using the mask, to feel okay taking a break, but importantly to do that when it's not visible to other people. In other words, to go somewhere where you're relatively alone and you're taking the mask off, and not necessarily setting an example for other people to see that you're wearing a mask improperly and that it's okay. So I think that's a really critical point to remove stigma. Clearly, there are going to be people who are not responsible and who don't necessarily care and don't understand the importance of mask wearing. But I think there's just as many people who want to wear a mask, who want to do what's right, not only to protect themselves but others, but feel anxious about it. And we should be doing everything we can to support them, to help them, and give them an opportunity to feel comfortable wearing a mask rather than applying shame and blame and judgment, because again, that's more likely to alienate people and to push them further away from a healthy practice than it is to attract them towards doing so.
Yeah, that's very true. Like, wear a mask and spread a positive message, right? It's more like, and then that way you inspire people to join in and wear a mask too.
Peer pressure is a very, potent, trigger for us when we are in a society where visual cues are a big part of how we behave and what becomes normative in terms of our daily practice. It applies to children as well. A lot of people have expressed anxiety and concern and doubt about whether children can wear masks. It's going to be difficult for children to keep them on. Frankly, my experience has been entirely the opposite. When I go out in public, I see kids enjoying their masks. They have colorful designs on them. They're superheroes on them. It's a way that they can accessorize their own sort of personality in some way or other, and they enjoy it. And when they see other kids wearing masks, it makes them want to do it. I don't really see why this can't be the same thing for everyone. There's all kinds of really neat masks that adults wear that are fashion statements that are very effective. And as much as we can normalize this practice and make healthy decisions and healthy habits something that creates a positive attitude that can easily spread, that's going to benefit us much, much more from warnings and fear mongering. And as I said, blaming and shaming. That's not likely going to be very sustainable or beneficial in any way.
True. Make it a part of your total ensemble. A statement. Do you have a special message for people who are watching, whether they believe in masks or not, or whether they're following protocol, or just the fact that we're living here right now in this pandemic? What is your message for them?
That there are very strong feelings and attitudes that some people have about the idea of being quote unquote forced to wear a mask. I think we have to remember that there are a lot of things that we do in our everyday life that are fairly commonsensical and that have been mandated either by law or otherwise. And people do it. It may feel like it's an affront to their individual decision making and freedom, but people do it because intuitively it makes sense that it is keeping yourself and others safe. Seatbelts are not 100% effective. If you get into a car accident, the seatbelt might save your life. It might not. I don't think there are a lot of people who would say that they refuse to put a seatbelt on because it's an affront to their freedom, knowing that logically it could save their lives or save the lives of someone else. I don't really see wearing masks as much different from that. It's a little bit more of a physical constraint in terms of your ability to breathe as comfortably, perhaps, or to communicate with others. But there's ways around that. There are clear masks that allow for people to be able to read lips. There's an organization called the Como Foundation that makes lips for people who are deaf. Makes masks for people who are deaf or hard of hearing, and I've worn their masks. There are masks made out of different fabric that are more comfortable to wear. There are different clips that you can put on the back of your head to prevent the irritation around your earlobes from wearing the elastic loops. There's all kinds of things that we can do to make mask wearing not such an encumbrance. And I think it's just logical that when we're in a pandemic and dealing with something that is fairly unpredictable in terms of who it will strike, how deadly it can be, and the scale of devastation that this has cost the world in the past 6 months, I can't understand the logic behind avoiding a fairly simple, I won't even call it sacrifice. I don't see it as a sacrifice. I see it as a simple measure that we can all take to both protect ourselves and others. I think we have to get past this idea that it's a big ask. It's not, and it's hopefully not going to be something that needs to be a permanent part of our lives. It's maybe going to be something that we're going to need to really help get over this until we're in a situation where we have a credible and effective and safe vaccine. And this becomes something that maybe is a seasonal issue, but is something that we can live with on a yearly basis, as opposed to something that causes us all kinds of fear that our economies will never recover and that mental health will never recover because we've had to endure restrictive measures that don't seem to go away ever. We really have to wrap our heads around that and determine for ourselves if it's worth putting up this big of a fight against something that stands to cause just so much more benefit.
Thank you so much for sharing your message, Dr. Sharkawy. I remember me as a mom or just a person, whenever I would feel something's wrong with me or with my kids or with my husband or with the family, I got to talk to a doctor. And the moment I've spoken with a doctor, my anxiety level just goes down and I feel more calm. It's just exactly what you made me feel today. And I'm sure that the audience who's going to hear you, who's hearing you right now, is going to feel that assurance that it's not the end of the world if you follow directives. Even the pandemic it's not a hopeless case, right? Because there are options. There you are, and everyone who's giving it their very best so that the community will be safe. The rest of us just needs to listen.
In Canada, with some moderate differences between different provinces, by and large, we've been receptive to public health policy when it comes to distancing, when it comes to hand washing, when it comes to masking, when it comes to self-isolation, if we experience symptoms or we've traveled somewhere. And the proof speaks for itself. That's not a coincidence. That's a direct reflection of the fact that we listened. We took it upon ourselves to ensure that this is something that we hold very near and dear to ourselves in terms of our accountability, not only for our own health, but that of our neighbors and people who live in our communities. And you compare that to what's happened in the United States, where there's very little leadership around the idea of public health guidance being a huge priority. There's a real rift in terms of people politicizing the idea of masks and any sort of restrictive measures as being an affront to their freedom, compared to those who think that it's obviously important. And the horror that is being witnessed in the US cannot be attributed to anything but that real lack of awareness, the lack of vigilance, and the lack of execution when it comes to those very, very important public health measures. It's not an accident, and I think we have to be increasingly aware of the fact that if we let our guard down, that's where we could be, and we don't want that to happen. We should be very proud of our commitment as Canadians to one another and to our sense of social citizenship, and we shouldn't let go of that.
Before we end the show, Dr. Sharkawy, I just wanted to really thank you for what you're doing. I know that you and the rest of the doctors and nurses hardly have time for your families, and you are prioritizing strangers, people, because their lives are at risk. And we could never express our gratitude to all of you for putting yourselves in the line of fire, as they say, and risking your own lives. We've lost doctors along the way, and that is sad, because these are the people who come to the rescue the first time that we get sick. And on behalf of Vancouver, thank you so much for joining us. I am so thankful that you devoted your time, busy dad, busy doctor, busy husband, and here you are. You spent this valuable time to share with us and to make sure that everybody listens and hopefully takes an important lesson from your input.
Thank you very much for having me and for giving me the opportunity to connect with more beautiful Canadians, including the wonderful people of Vancouver and the province of British Columbia, where I spent many formative years of my childhood. You're very lucky. You've got a fantastic Chief Medical Officer of Health and Dr. Bonnie Henry, and it's no surprise that BC has done as well as it has. Just one parting comment that I'll have is the great thing about this pandemic is that we have actually become closer as a global community rather than farther apart, because the fear and the anxiety and the uncertainty has, I think, created a longing for a sense of knowledge and a sense of guidance to help us along the way. I think that has brought people closer together. I would recommend that people continue to seek knowledge, guidance, connect with one another, and to resist judgment when they are having a dialogue around any issues, and instead look towards understanding and open-mindedness and compassion. And I think that'll carry us much further as we try and get through this pandemic and grow as a global community.
That is so true. The pandemic has opened our hearts and has brought out the best in humanity. Thank you so much, and you take care, Doctor. You stay safe, and know that when you go through the hardest of times, we're right here thinking of you. We know that there is light at the end of the tunnel. It may not be soon, but we're getting there. And it's good to know that we Canadians are truly coming together, showing compassion, spending more time with one another whenever we can, following directives, listening to doctors, and really setting aside ourselves and just thinking about the community, thinking about our loved ones, because the pandemic is a great lesson for us all and is a great opportunity for us to come together, open our hearts, and let compassion rule above all. Every little bit of effort is a step towards healing and recovering. Nothing is more important than listening to one another and sharing our positive stories. You take care, stay safe, and don't forget to follow advice. Remember the C's and the W's. We got this. Bye for now.